It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Grace Sells, and welcome back to another edition of the Best Docs Network, of course, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And speaking of helping change people's lives, Grace, there's one lady excited that the summertime is almost here.
That's right. Lisa's life was completely changed after she had the gastric sleeve procedure. With bariatric surgeon from Bariatric Solutions, Dr. Scott Stowers.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients.
I met with the actual surgeon. I actually sat down with Dr. Stowers and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she'd lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
When a patient comes into the clinic, I want them to feel very welcome. I want to have a clinic that's a nice, warm, inviting atmosphere. I want to treat them as I would a family member, my own family member. The first person they see is Sonia. She's the receptionist, office manager, kind of the patient go-to person for any needs that they might have. She's always makes it a point to welcome every patient, make them feel invited, make them feel comfortable, and let them know that she's there for anything outside of the medical treatments that the patients might need.
We really do like to get to know our patients as much as possible on a more personal level so we can individualize their treatment plan and help them in any kind of recovery process in order for them to be pain-free and make it as smooth as possible.
The second person that a patient meets is my nurse, Kelly. She's very instrumental in the treatment process for me. And then she's very instrumental in the backside of things, and so is Sonia. Kelly's very instrumental in the post-operative or the post-treatment plans. She's pretty much the go-to person to talk to when patients have any issues whatsoever post-operatively.
Through my professional experience, I'm trained to care for all of his patients in the pre-op and the post-operative setting by providing education and what to expect during their visit, during their surgeries, and then also in their post-operative care. Initially, when I meet with Dr. Williams' patients, I review their history, their major complaints on why they've chosen to come to Dr. Williams in order to provide the absolute best information that I can for Dr. Williams to perform the surgery.
When patients come in, they may have a lot of questions about their pain and treatment options, and we are always here to answer any questions that they have.
From the moment a patient walks in my door and they meet me, I want them to understand that I'm going to take the time, do what it takes to get them from the point they are when they meet me to a point where they're 100% pain-free, no matter how long it takes.
Hi, I'm Dr. David Azouz with Best Docs Network. Today, we do liposuction on all parts of the body, including the abdomen, the thighs, the knees, the arms, the neck, the face. If you are interested in more information, log on to bestdocsnetwork.com.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress. On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you, which could be our next doctor. We're going to hear about how important skincare is from plastic surgeon Dr. Robert Wilcox.
We have a very active skincare department as part of our aesthetic practice. When patients come here, we are very proud that we can offer them either surgical rejuvenation or skincare.
I think skincare is your icing on the cake. It's going to help address whatever issues you have for tone and texture and evening out skin color.
Some people are just looking for a more youthful look. They don't really need surgery. So these different facial fillers actually enhance their face and make them look a lot younger.
That in conjunction working with Dr. Wilcox and his specialty of surgery, kind of lifting, and Vicki helping plump out and fill lines and smooth lines, the whole thing just works really well together.
Every patient is specific and every need is specific for that patient. So many of them will tell you, they'll tell you, you know, what they're looking for, and then you just kind of go from there.
Consultation entails me examining the skin, and then I can tell you what I think would be the best protocol for what you have going on, whether it's wrinkles or acne scarring or active acne or sun damage. It's usually a program of products, lasers, and chemical pills that will progress along this way to get your skin nice and pretty and glowing.
Many of my patients range from the age of 25 to 70, and I am seeing a lot more men these days. They too want to look better and enhance their appearance. They're competing a lot of times with a lot of guys that are younger than them, so they too want to look really refreshed too. These treatments stimulate collagen and slow down the aging process. They don't correct, they actually improve your overall appearance.
If we can offer either skincare or surgery, then the patients are comfortable knowing we're going to offer them the best treatment for their particular problem.
Coming up next, James, a wounded warrior with a skull fracture, receives a smile makeover. Plus, find out which foods contain antioxidants that could prevent cancer. All this and much more when we return.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
Don't skip breakfast. Fiber in the morning means less hunger late in the afternoon when you most likely feel tired and gorge yourself on sugar. An early start on eating also keeps your metabolism more active throughout the day. Breakfast eaters are thinner than people who just rush out the door.
Hello everyone, we're in the studio today with one of the top facial plastic surgeons in the Dallas-Fort Worth area. It's Dr. Yadro Ducic. Thank you for joining us today.
Thank you for having me.
Of course. So you're double board certified. Tell me a little bit about what other areas you specialize in.
Well, I do a fair amount of reconstructive surgery as well, so we deal with a lot of facial trauma patients, head and neck cancer patients, skin cancer patients, and it's a lot of those folks you're removing parts of their face and then reconstructing and rebuilding them, and it really kind of flows nicely into cosmetic surgery because you're doing similar sort of things. It's all about making people feel better about their appearance and function better.
So tell me, Dr. Ducic, you have a unique philosophy, and tell me what your goal is with patients.
Well, I hope it's not too unique. I'd hope that most facial plastic and plastic surgeons felt the same way, but you know, by the time a patient comes to see you, for whatever the problem is, whether it's a crooked nose, a mole on their chin, a weak chin, loosening of skin, whatever the issue is, they've thought about it for a long time. They've looked in the mirror, they've critiqued themselves, sometimes they've even shed a few tears. And so the last thing we need to do is to make them feel more uncomfortable about other things. And so I think it's important to address what their concerns are, recommend procedures or surgeries if they're appropriate, and reassure them that they'll do fine even if they don't have anything done. Because the most important thing you want is for them to walk out of the office feeling good about themselves. And the most important thing we want after surgery or procedures is for patients to feel good about themselves. The last thing we want is to create more anxiety by pointing out other flaws, which all of us have. That's what makes us human.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Here's how to eat more healthy. Eat foods that are red, orange, or yellow. Those tend to be the good fruits and vegetables. Eat more chicken and fish and fewer steaks. Eat higher fiber foods. Bananas are probably the best thing you can eat. They are high in potassium, they are high in fiber, they're high in vitamins, and just generally good for you in every way. There's nothing bad about a banana. Anything that comes in a bag, a can, or a box is going to be bad for you. It tends to have preservatives, and those won't help you digest well, nor are they good for you. Eat a Mediterranean diet. You can Google the Mediterranean diet. They're high in olive oil, high in the white meats, not the red meats, and they tend to emphasize the vegetables and fruits like lentils and beans and peanuts. This is always good for you. So basically, if you're eating what they eat in Athens, you're eating the right kind of stuff.
For more information and to check out hundreds of videos, just head to our website. It's bestdocsnetwork.com. Now, Jim, I know I wish I could improve upon my smile.
Well, we have just the doctor for you. You're going to love this next story because Dr. Guy Lewis, one of the top cosmetic dentists around, helped put a smile back on one individual's face.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner, and so he's seeing people in the clinic, and so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile, and then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
I am a referral specialist for 4 doctors, and what I do is I receive referrals from other doctors. And then the doctors, they see the patients, and if they tell me that they need to be referred to have a CT scan or an MRI, then we choose the facility, which I prefer preferred imaging, and then I send them an order for them to have either an MRI or CT scan.
Preferred imaging stands out in customer service excellence. I'm able to get our patients in same day, and the patients are happy. They get in, they get out.
I've heard that patients, when they come to the preferred imaging, they feel like they get first-class service and very nice people to work with, and as if they were going into, on a airplane flight, it's first class all the way through.
Because we get the results within 24 hours, we're able to get the patient back right away and the same week. And we can diagnose the patient via the MRI results, and we can therefore know how to treat the patient and go from there.
They're always nice on the phone, they're eager to help, and there's no miscommunication at any point at all. So it helps me when I'm able to call any facility that I can, and then they're there to help, and they're always nice. And it makes it easier for us.
Preferred Imaging has 14 imaging facilities around the Dallas-Fort Worth area, and they do have extended evening hours during the week, and they're also available on Saturday and Sundays. So it accommodates all of our patients' needs, whether they have to go after work, before work, on the weekends. They really make it easy for the patients. We send over an average of 10 to 15 a day. Our experience with Preferred Imaging it's amazing.
For more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Of course, Best Docs Network is all about doctors helping change people's lives, like our next doctor, plastic surgeon Dr. David Azouz, who helped one individual feel a lot better about himself.
I had a condition called true gynecomastia, and the condition is basically a hardening of tissue in the chest area. And so unlike some of the other people that have that, it was actually hard tissue, it caused pain, and it was pronounced through clothing, things like that. It was more pronounced on one side than the other. And so that kind of began the search where I looked for doctors for about 3 years.
Gynecomastia is a very common problem for many men where they have the physique in their chest that's more female or feminine, and that's why it's called gynecomastia, feminine breasts on men. And obviously most men are not happy to have breasts, and they want to have that corrected. So they like to have prominent pectoral muscles, they like to show a lot of musculature, but they don't want to have breasts.
So I talked to my primary care physician, and then I started to look at different plastic surgeons in the Houston and the Dallas area. And without even examining me, most of the doctors would tell me the procedure right off the bat, and usually that entailed to do multiple cuts around the area, multiple incisions, and then go in and from all angles take out that tissue. So I knew that that wasn't something that I really wanted to do because it was going to leave a lot of scarring. So I put it off, and it ended up, like I said, it took about 3 years. And the first time I went into Dr. Azouz's office, he told me flat out, I'm going to stay here until we answer all of your questions. And he kind of went beyond that. I mean, he came up with questions that I wasn't even thinking about. And within a few minutes, I knew he was the man for the job. I mean, he actually examined me before he made any recommendations, and then he kind of went through the whole procedure. And the procedure was going to be, 2 really small cuts, which I kind of didn't believe at first, to be honest, because I'd been told by so many other doctors that that wasn't possible, that they would have to do multiple incisions.
And what we do is we take off the breasts by making small incisions under the areola, and through liposuction and sometimes excision as well, we remove the breast tissue and we give them better contour.
Now that the procedure's done, all I have is praise and thanks for Dr. Azouz. Without him, I would have probably gone to one of the other doctors and been unhappy with the results. My life has truly changed as a result of this procedure, and I would highly recommend it to other people.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
Traditional MRIs cost a fortune and are uncomfortable, usually done in small, cold hospital rooms. But you have a choice. You can have your imaging done at Preferred Imaging in a comfortable environment with superior staff and technicians that make it simple and stress-free. Even better, Preferred MRI costs 2/3 less than the traditional hospital MRIs. And with 18 state-of-the-art locations, it's easy to find one near you. Call now to find out how you can save on any of your imaging needs. Preferred Imaging. Imaging made easy.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
Aging is a multidimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen and elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, helping change people's lives. Good news is, Grace, for more information about any of these outstanding doctors, all you have to do is head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question or comment or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.